Hey everybody, hi, it's Melissa Lorello. It's been a long time since I've been on, posted anything on YouTube or Facebook or anything really, so I thought it was about time to get on here and let you know how I'm doing. Since I had my Transforma procedure done, as of this past Sunday, the 21st of October, it has been 1 month since I had my neurostimulator put in, and I'm doing well. I have had, let me think, I've had 3 major migraines in a month, which isn't bad at all. And I actually did okay by doing an injection of Imitrex, and I took my pain med cocktail that I do with my when I get a migraine, and it actually worked, whereas before it wouldn't have touched it at all. So that's a plus. Yeah, I'm doing very well. Besides those 3 migraines, all of my other days have been migraine free. And so that's very exciting. One thing I do want to sort of touch base on, though, is it's a lot. It's very overwhelming after you have this surgery done and you go from having pain 24/7 and it goes down to 3 a month. It's a big life changer, which is good. It is really, really good. But I think I'm still having the migraines because I think I'm having them every day. It's just the stimulator's doing its job and it's directing those pain signals elsewhere, which is fantastic. And I'm amazed by the technology and what it does. But it doesn't take the other symptoms away that you suffer when you get a migraine, like the extreme tiredness, like your migraine hangovers that you get, how I describe them, and the great fatigue that you feel and certain things, and the depression. I'm having a problem with that. I thought that once the pain was gone, like I had depression while I was in pain 24/7, and I thought it was mainly due to the pain. I'm still having depression. I think a lot of it has to do with coming back into this world coming out of a world that I was in for 2 years. And some patients are in it far longer than I was. Now, I've suffered ever since I was about 12 years old. So, I've suffered for over 25, 30 years, I guess. I'm 44 now. And, I've suffered for a long time with them. But since I had my stroke-like attack 2 years ago in September, I was bedridden for pretty much 2 years. So my body hasn't been out there getting used to having exercise, and I tire out really, really fast. Like, for example, the other day I got up just to do the dishes, things that couldn't go in the dishwasher, and I tired myself out by doing dishes, which isn't right. So it's sort of depressing. Also, when I had my attack, back in 2010, I lost my job due to that. So now that I'm feeling better, I don't have that to go back to, nor can I go out and get a job right at this point, because so far I've had 3 migraines, but I've had one like every week. So I don't know any employer that would allow you to take off a day a week due to a migraine. I know if I was the employer, I sure as heck wouldn't want that employee to be taking off. So that's a little depressing. But I'm so happy. Please don't get me wrong. I am thrilled that I have this whole new life to, jump into and don't know where it's going to go. That's exciting. I'm looking for great things to come in the future. My daughter has gotten engaged within the past few months, and I actually get to help her plan her wedding, which before, when she first got engaged, that was something that I was terrified of. So now I get to plan it, and I don't have any feelings of, oh no, what if I have a migraine that day? That hasn't even been a thought of mine. So that is so awesome. It's wonderful. But I bring up the depression only because if you are looking into having this procedure done, which is the Transforma procedure, it's, in case you haven't been following my story, it's a neurostimulator that has 4 leads. It does the occipital nerves in the back. There's 2 in the back, and then your supraorbital nerves in the front, which are the 2 right above each eyebrow. So a lot of places only do the 2. This one is 4, so it covers your whole head. So if you are planning on having this surgery done and you've been laid up for quite a while, my suggestion to you, and I'm not saying it's going to happen to you because everybody is different. This is just what's happening to me, and I want to forewarn people out there that this can happen. Not that it's going to, but it's a possibility that once you go through the procedure and you come home, it's a big adjustment. It's huge. So I just wanted to put that out there, that you might want to have that on the back burner, especially if you don't have family support. Now I do. I have, my husband's wonderful, my family's wonderful. I have that support, and my friends are great. But especially if you don't, I would put it on the back burner to have arrangements or plans, or start looking for someone to set up an appointment with to talk to about things, because it is a huge change in one's life. It's huge in my life. It's huge in my daughter's life. I have a 12-year-old that isn't quite sure how to act. She's happy that I'm not up in bed anymore, but she was used to running the house here until my husband would get home from work, because I would usually be up in bed, which I'm not up in bed now when she gets home from school. I might not be gung-ho doing everything I expected to do when I first came out of surgery, but at least I'm home, and when she walks in the door, I'm, how was your day, and what homework do you have, and everything. So, and checking to what she's snacking on and things like that, whereas before, who knows, that sounds horrible, but I mean, I knew what was in the house. I knew there was, available nutritious items, but whether she was grabbing those or the Doritos out of the closet, I wasn't quite sure. So now I do. So she's adjusting to that. So it's not just an adjustment for you, but it's an adjustment for your whole family. My husband's a little concerned that I'm down. I guess we both expected me to be so up in the air about everything. I think if people have this done before they get to the point of losing their jobs, and when they come home and they have their career to go back to, and their mix of friends and everything, I think that would make it a lot better on someone. When I became chronic, I lost a lot of my my friends that I would talk to on a daily basis or weekly basis or whatever, and stay in contact with them. When I became so ill that I couldn't work, I didn't return phone calls. I wouldn't let anybody in. You have to understand that when this first happened to me, they thought I had a stroke, as I've mentioned before, and I had a droopy mouth. My speech was horrible. I had to relearn how to talk and walk because my right side was done. It was gone. So I had to go to occupational therapy, physical therapy, speech therapy, you name it, therapy, I was there. And yeah, so anyway, I had to relearn how to do all that stuff. So I don't know. I went into this shell after it happened that I didn't want anybody to see me or hear me talk the way I was talking, which brings me back to something. And I'm sorry to be all over the place here. I just have so much to say and so little time to say it. But one of the things I've noticed, which is a godsend, is the 3 migraines that I have had since having the Transforma device done. I haven't seen any of the droop. Not like it was before. There might be a little bit there, but my speech has remained intact. I don't know if it's because I'm getting the pain like crunched so quickly with the injections and laying down for a few hours or something, but it's been remarkable. So that, we'll see how that goes. But so far, I have been so pleased. I want to wrap this up so that YouTube will allow me to post it. I did this a little bit ago, and it made it too long, so it wouldn't post for me. So I'm trying to remember everything I put on the last one. If you are interested in the procedure, the neurostimulator, the Transforma device, I had it done by Dr. Chapman, who is out of Houston, Texas. You can get in contact with people there through Advanced Migraine Relief and Treatment Center. They have a website. It's called chronicmigrainehelp.com, and that'll put you in touch with people that can help you learn more about this procedure. Also, another shout out I want to give is to CMA. It's Chronic Migraine Awareness. Great group of people that are there to research and help you. Even if you just want to vent, they're people that know. Everybody on there suffers from migraines, so they know no matter what stage you're at, they know where you're coming from, so they can relate. And that's on Facebook. So if you just look for Chronic Migraine Awareness, that'll take you to their Facebook page, and we can really help. I mean, I'm involved with Chronic Migraine Awareness, not as much right now as I'd like to be, I think, just due to coming home and getting reacclimated to everything, but great group of people. And again, for Advanced Migraine, to get in touch with people from there, they are wonderful. I can't say enough good things about them. Again, their website is chronicmigrainehelp.com. So thank you guys for following me. I will post as things happen. But I did want to do this 1 month and let you know how I've been doing, because so many people have been emailing me. I have hundreds of emails that I haven't gotten back to. People have been Facebook messaging me and everything, and I've just been in my own little world. So I apologize for not getting back to you, but if anybody has any questions about the procedure I had, please contact me on Facebook. I promise to get back to you. And if I can't answer your questions, I will put you in touch with somebody from Advanced Migraine that can help you and get those questions answered for you, okay? All my love to you guys. Wouldn't be able to do this without you. Take care, and I'll be in touch soon. Thanks so much.